Hello, I'm Professor Emily Mercuri, and this is Chapter 10, Poison Control in Essentials of Pharmacology for Health Professions, Ninth edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to 1. Identify 4 routes by which poisons may be taken into the body. 2. List 5 conditions in which vomiting after the ingestion of poisons could be injurious to the patient. 3. Describe the first step to take in the event of any poisoning and the procedure to follow. 4. Explain the purpose of activated charcoal and when it is given. 5. Describe clinical procedures required when caring for patients who have been poisoned. 6. Describe appropriate therapy for poisoning by inhalation, external poison, and insect sting. 7. Identify 2 groups of people at risk for poisoning. 8. List 10 recommendations for patient education to help prevent poisoning. 4 routes of poisoning. A poison is any substance that interferes with the normal physiologic functions when taken into the body, either by inhalation, injection, or absorption. In some cases, only a small amount of substance can cause severe tissue damage. In other cases, the substance can be beneficial in small amounts but lethal in excessive amounts. There are 4 ways the body can take in a substance. These include ingestion, entering the body by swallowing a substance; inhalation, enters the body by breathing in toxins; injections, enters the body through a bite or a sting; or absorption, enters the body through the skin. Knowledge check. Venom from a snake is considered a poison that enters the body through which route? A. Absorption, B. Inhalation, C. Injection, D. Ingestion. And the answer is C. Injection, because the venom comes from the fangs of the snake, so it is being injected via a puncture wound to the skin. Poison by ingestion. Ingestion by swallowing is the most common form of poisoning. Children aged 1 through 5 are most at risk. Prior to 2004, it was recommended that children receive emetic ipecac syrup to induce vomiting. So just so you know, the word emetic is vomiting, or emesis is vomit. After further research, they found that the method of ipecac failed to demonstrate effectiveness and had adverse effects that could interfere with other treatments. Evidence also showed a widespread abuse of ipecac by people with anorexia or bulimia. As you can imagine, if you are being asked to induce vomiting, sometimes what is coming up can actually be more dangerous coming back up and more caustic to the tissue of the esophagus. In case of a suspected poisoning, contact the Poison Control Center directly or through an emergency care facility at 1-800-222-1222. And you can also go to their website and request magnets or like cards. I have a magnet on my fridge that has the number of Poison Control, just so if I ever forget, it's right there in case one of my children ever, or husband or anyone in my household ever comes across poison unintentionally. Prior to 2004, individuals were advised to induce vomiting after ingesting a poisonous substance. While at times this may still be a treatment plan depending on what they ingested, there are 5 conditions where vomiting can be injurious to the patient and should be avoided. The first one is ingestion of corrosive substances such as mineral acids or caustic alkalis. These are things like ammonia, drain cleaners, oven cleaners, dishwasher detergent. These substances cause tissue damage during ingestion, and they also damage the tissue when vomiting. So sometimes the stomach and intestines have a better chance of neutralizing these substances versus vomiting them back up, which could corrode the tissue, which could be very caustic to the tissue of the esophagus and mouth. Ingestion of volatile petroleum products, gasoline, kerosene, lighter fluid, and benzene. Vomiting of these can cause aspiration or asphyxiation, so it can move over into the lungs. Ingestion of convulsants, strychnine or iodine. Vomiting can precipitate seizures, so vomiting these substances can actually lower the seizure threshold and make the patient have a seizure. If a patient is semi-conscious, in shock or inebriated, meaning they're drunk or otherwise impaired, vomiting could cause choking, aspiration, or asphyxiation. And if a patient has cardiac or vascular disease, vomiting can increase blood pressure and precipitate a stroke or other serious cardiac issues. Knowledge check. Which of the following represents a possible injury of forcing a semi-conscious patient to vomit after ingestion of a poison? A. High blood pressure, B. Asphyxiation, C. Stroke, or D. Precipitate seizures? The answer is B. Asphyxiation. Sometimes in an emergency setting, we will place an NG tube down the nose and into the stomach and put it to suction and pull the contents of the stomach out if somebody is semi-conscious or unconscious. But even that, we need to know when they ingested the substance and what type of substance to make sure that it's a safe thing to do and that it's beneficial versus possibly causing more harm. Steps and procedures to follow. The first step to take in any poisoning is to contact your local poison control center. This number can be obtained by calling 1-800-222-1222. They can direct you to the local poison control center. This number should be programmed into your phone for quick access. Callers should be prepared to give details regarding the following: what type of poison or suspected poison, age, approximate weight, health status of the individual, advise of any allergies and or asthma. Knowledge check. Which are procedures that should be followed in the event of a poisoning? A. Call poison control, call emergency contact, report age, report allergies. B. Call poison control, report height, report age, report current medications. C. Call poison control, report gender, report weight, report allergies. D. Call poison control, report age, report weight, report health status. The answer is D. Call poison control, report age, report weight, report health status. What do we mean by health status? I found this patient with a bottle of drain cleaner next to him. He is 14 years old. His approximate weight is 140 pounds, and he is currently unconscious, right? The health status is, how are they right now? How are they responding? Is there an effect of that medication, of that poison in their system? And when we call poison control from the hospital setting, they're very good at giving us guidelines about what to monitor and how long. So, they ingested this. For the next 12 hours, you need to closely monitor their cardiac status, something like that. So they know how long those things stay in the system. They know exactly what to monitor for, and they're really a great resource. Purpose of activated charcoal. Activated charcoal is a substance that is administered by mouth to minimize systemic absorption of an ingested poison. If needed, gastric lavage, which is like irrigating the stomach, followed by or preceded and then followed by activated charcoal. That's complicated wording to mean either giving the charcoal and then doing the gastric lavage, or doing the gastric lavage and then giving the charcoal and then doing it again. It may be more effective than just activated charcoal alone. It's important to know that activated charcoal may interfere with antidotes given via the gastric route. Reason being is that you're putting it into the stomach to kind of absorb the poison, but if you gave some kind of antidote to the poison already, it's going to also absorb that antidote. The clinical significance of this is still unknown. The routine use of gastric lavage is no longer the first choice in the treatment of ingested poison because there's a danger of perforating the damaged tissue of the esophagus for those who ingested corrosives. So it used to be that they would automatically shove a tube down your nose and into your stomach and just start irrigating, like pushing water, pushing fluids into kind of irrigate the stomach lining and then pull all that back up via suction. But it can cause perforation. It can cause more tissue damage to the esophagus, especially if you have an unknown corrosive substance or an unknown substance in general. You don't know the damage you could cause by doing that. Knowledge check. Which describes the purpose of activated charcoal? A. Minimize systemic absorption of ingested poison. B. Assist in maintaining blood pressure after ingesting a poison. C. Reduce the chance of seizures after ingestion of a poison. D. Reduce aspiration or asphyxiation after ingestion of a poison. And the answer is A, minimize systemic absorption of ingested poison. Clinical procedures. When caring for an individual who has been poisoned, the following clinical procedures regarding patient care should take place. First, make sure you save the emesis. Remember, that means the vomit. It may be necessary to send it to a lab to determine the type of poison. In addition, save any evidence of what might have caused the poisoning, such as plant parts you found near the patient, mushrooms, pills, bottles of cleaner. If there's any doubt about the poison, the physician may order urine and blood tests for toxicology. Not all poisons can be detected in a urine or blood test, but many of them either have a direct test or the way that the normal laboratory work, the electrolytes, etc., is altered gives us a clue as to what they may have ingested. Closely monitor the vital signs of patients who've taken poison of any kind, and observe closely for possible confusion, tremors, convulsions, visual disturbances, loss of consciousness, respiratory distress, or cardiac arrhythmias. Knowledge check. When caring for a patient being treated for poisoning, all should be continually monitored except A, tremors, B, loss of consciousness, C, increased energy, D, respiratory distress. And the answer is C, increased energy. You would be expecting decreased energy or lethargy from a patient who ingested a poison. Appropriate poisoning therapy. Based on the type of poisoning, there are various treatment therapies that can take place. The following are common treatment therapies for inhalation poisoning, external poisoning, and poisoning by a sting or snake bite. So for inhalation poisoning, fresh air, oxygen, and then CPR if indicated. Some types of inhalation can actually cause cardiac arrest. I think especially about things like carbon monoxide, or when someone has inhalation poisoning from being in a room full of thick smoke, like firefighters, for instance. We need to replace oxygen and we need to kind of flood their system with that fresh oxygen to release the binding of the carbon monoxide from the lungs. External poisoning. Flush skin or eyes for 20 minutes. So if it's on the skin or in the eyes or other mucous membrane, we want to flush and transport to an emergency care facility. You do sometimes run the risk of a very deep burn or of even loss of vision if it's in the eye. And so we want to flush as much as possible and then get them to an emergency care facility that will know what to do with that specific type of poisoning. And then for sting or snakebite poisoning, cleanse the area. Immediate removal of the stinger. For certain stingers, it's important that you are not releasing more poison. For example, if you've been stung by a bee or a wasp, you scrape it with a credit card so that when you pull it out, it doesn't actually release more of the venom. And if it's a snake bite, we do not want to apply an ice pack because we will actually run the risk of clamping down those blood vessels and the tissue necrosing or dying really quickly, because that's what's already happening within the vessels when you have a snake bite. Keep the patient quiet and calm and then transport to an emergency facility for treatment. We do see a lot of rattlesnake bites in our area specifically, and there's actually a doctor where I work, he's a snake specialist, and he comes in and he prescribes the anti-venom, which is a very expensive treatment, and he monitors the patients, and he's just this cool dude, like from Ramona, that wears cowboy boots. We love calling the snake doctor. But I want you to know that snake bites are kind of common in our area and that they are a medical emergency, especially for rattlesnakes. Other things that we see in this area, we do see black widows, and we occasionally can get brown recluses, although I don't know that they are native to this area. All of those things I've seen in the emergency department. So those are the more critical ones in our area. Knowledge check. Which best explains why you should not apply a tourniquet to the site of a snake bite? A, may cause a change in blood pressure. B, may cause the patient to seize. C, may cause sloughing of the skin. D, may cause rash to the area. The answer is C, may cause sloughing of the skin. We didn't specifically go over this, but we don't want to necrose or damage the tissue anymore. Sloughing of the skin is when layers of the skin start to come off and can actually do deeper damage. Let's talk about some people at risk. So, children and older adults are at the highest risk of incidental poisoning. Poisonings are the leading cause of health emergency for children across the nation, and due to their curiosity, poisonings are a major cause of death amongst young children. Older individuals are more prone to toxicity when they overdose on medications because their metabolism slows. Many medications and common household products resemble food and candy. Children may be attracted due to unique shapes and or colors used in the packaging. Impaired vision may contribute to mistakes made by adults, especially older adults. It's imperative to keep medications separate from food to ensure individuals are not fooled by lookalikes. On this slide, there are some examples of how medication can resemble candy. So on the first slide, a Tylenol next to an M&M, right? They look very similar. They're that bright red color. The next one is Pepto-Bismol next to like a Necco wafer, which Necco wafers are not something that you're probably familiar with unless you were born, not to age myself, but when you were born in the 80s or before, but they're a type of candy, but also like a lifesaver or a cough drop that can look similar to a Pepto-Bismol. And then the last slide shows Benadryl tablets, which are like this bright pink, and they're next to Good and Plenty's, which again, not a common candy anymore. It's like a little pink licorice. But either way, even if a kid is not familiar with the candy, that bright pink color could be enticing. That could be something that they're like, "Ooh, I want to explore this," right? Kids don't have the judgment and the fear of safety or thought of their own safety like an older adult would. Knowledge check, which explains why older individuals are prone to accidental poisoning. A. Poor memory. B. Impaired vision. C. Curiosity. D. Loss of taste. And the answer is B. Impaired vision. So how do we want to educate patients about the risk of poisoning? The public must be instructed on precautions with medications, especially parents and caretakers of young children and older adults. The American Medical Association recommends the following precautions. Keep all medications, household chemicals, cleaning supplies, and pesticides locked in a cabinet. Never transfer poisonous substances to unlabeled containers or food containers. That might sound silly, but we all have that family member who puts, oh, my window cleaner, I just put it in this Tupperware because the bottle had a crack, right? We don't want to ever be transferring something to a container that is unlabeled, or especially one that could be used for food, because that's confusing. Never store poisonous substances in the same place where food is kept. Never reuse containers of chemical products. Do not give or take medications in the dark. Make sure that there's ample lighting, especially for your older adults. Never leave medications on a bedside stand. I have a horror story about this. When my daughter was little, she reached up onto my bedside stand and there were a bunch of allergy pills spilled all over the floor when I walked in a few seconds later. And I panicked, like, how many did she swallow? So I was trying to count them, see how many had already been taken. Luckily, they were very bitter medications, so I was able to figure out she would have probably spit them out. And then I called poison control and they said, unless she took like 50 of them to just monitor her, she should be fine. But it was very scary. So never leave something on a bedside stand that someone could get to. And I know we're not talking in this lecture really about pets, but pets is a whole other situation, right? That your dog could get to, that your cat could get to. That's also important. Always read the label before taking any medications or pouring any solution for ingestion. And then never tell children the medicine you're giving is candy. This is huge. So we don't want to say, oh, it's candy, you'll love it, because we're tricking them. We shouldn't be trying to trick our children anyway, let's be honest. But we never want to confuse them by saying, oh, it's candy, because let's say then they go up into the cupboard and they're like, oh, well, this mom said this is candy, so I can sneak some candy. Another thing that's really important that is kind of on the rise is marijuana edibles. So a lot of times edibles look like a gummy, right? Or a gummy candy. And so we want to make sure that those things are up and locked away, clearly labeled, and nowhere near where kids can get them, because I have seen kids come in extremely high and having, hallucinations, needing to be monitored because they got into mom's gummy bears, whatever. So just be mindful of how we're storing things. When preparing baby formula, taste the ingredients and never store boric acid, salt, or talcum near the formula ingredients. So those are all things that could look similar to baby formula. Never give or take any medication that's discolored, has a strange odor, or is expired. Do not take medication in front of children who may see it and think that that looks enticing. Keep pocketbooks, purses, and pill boxes out of reach of children. And then rinse out containers thoroughly before disposing of them. There are more than 72 poison control centers throughout the United States with computerized data to give individuals the latest information about poison. Obtain the number of the nearest poison control center and place it near your phone or in your phone for quick access. Poison control, as I shared before, is a huge resource, and I love that what they actually do at the hospital is they will call me back maybe 6 hours later. They're saying, we're requesting an update on this patient, and you don't have to share HIPAA information, so you don't give name, date of birth, anything like that. But they call to check up and say, have you noticed anything in the monitoring? Is there anything else that you need from us? Has their condition changed? Because they want to make sure that you have all the tools that you need. Knowledge check, which is not considered patient education for poison prevention. A, do not store medications in the refrigerator. B, always read the label before taking a medication. C, never reuse chemical product containers. And D, never take medication in front of children. And the answer, which is not considered patient education, is not store medications in the refrigerator. If you do have medications that need to go in the refrigerator, just make sure they're stored in a separate compartment and clearly labeled away from the food. Self-assessment. What are the 4 routes that poisons can enter the body? What is the use for activated charcoal? And which 2 groups of people are at a higher risk for poisoning? Thank you for listening. This has been Chapter 10 of Essentials of Pharmacology for Health Professions, 9th edition.